trauma, trapped emotions, and even just subconscious beliefs are major impediments to healing when it comes to complex chronic illness. So, today, in dealing with this topic, I'm super excited to talk to Dr. Mark Sylvester, Megan Earls. We're going to talk about SST therapy. What is it? How to work with healing these aspects of your issues so we can get to new, profound levels of health. Guys, thank you for joining me today on the Outside podcast and the MBM podcast here. Just give me like a 2 second intro, Meg, especially for you because you haven't been on as often. Can you give me a really quick intro into your background?
Yeah, my name is Megan Earls. Thanks for having me. Excited to be here. I'm an LCSW in private practice in Sarasota, Florida. And most of the clients that I see have PTSD or complex PTSD, working with adults.
Love it. And then Dr. Sylvester, you're here with me all the time, but just give me a quick 2 sentence there.
Yeah, thanks for having us. Excited to talk about SST. As a psychiatrist, I don't do a large amount of psychotherapy, but I absolutely can't imagine my practice without SST. So hopefully we can answer a lot of questions and expose people to this exciting breakthrough trauma therapy.
Yeah, so for SST, right, synchronized synergistic therapy, either of one of you jump in, but what would you say is the baseline definition of that? Because we refer you guys, like folks to you guys for SST. We share a lot of patients and clients for that very, very good reason. But how would you and either of you jump in? How would you define SST therapy?
SST is a psychotherapy model that incorporates a psychotherapist with a body-based practitioner at the same time. So instead of just having a psychotherapist or just having a body-based practitioner working with a client, we merge together, synchronize our treatment simultaneously with the client to help support the release of emotions from both the mind and the mind and the body at the same time.
Love that. So integral to what we do in our office. And what I've seen, I've had the benefit of participating in some SST sessions and seeing that in real time and the powerful aspect of that. And so, in what sort of cases, Dr. Sylvester, would you say that you love to do the SST sessions on?
Yeah, SST is great. And what we've learned over the years through developing the program and the practice and the curriculum, all of that, is people with PTSD, whether that's an acute traumatic event, a stress reaction, or a long-term chronic PTSD with layers stacking, typically treatment refractory folks, things where ordinary talk therapy hasn't been enough, but even acute grief reactions, um, depersonalization, dissociation, realization. These are all dissociative symptoms that may be indicative of more of a body-based approach. And also folks that are comfortable and familiar and open with somatic therapy. Maybe they've had experience with neurofeedback or acupuncture or massage and have tried other things and are either stuck or have incomplete healing.
Yeah, I love that aspect of like when you're stuck, whatever you're doing, whether you're coming from the mind side and psychotherapy or the body side, functional medicine, body work like massage therapy, acupuncture, when you get that stuck point, something like SST, we love to refer to. But I'll be honest, in our practice, I would say all of our complex chronic illness cases, Lyme, mold, PANS, pandas, whatever it is, doing something like SST is key, right? We gotta release that. And so, Megan, what I would ask you is, in your practice, how do you see that integrating the body work or really like the trapped emotions, the trapped trauma in the body, especially for patients dealing with physical, right? Because we're not talking about, oh, you're psychosomatic here, or like, right? We're not talking about conversion disorder. We're talking about every sort of case. So, Megan, in your practice, when you see patients with whatever diagnosis, how would you say that like the trapped emotions or the body piece of that deals with the psychotherapy and then using SST for it? Just, I want to hear you talk about that.
Yeah, so in my practice, in my office, if I have a client sitting across the room with me in a traditional psychotherapy session, I'm observing their body reaction to the emotional stuff that we're talking about. There's only so much coaching that I can do verbally as somebody who's not a body therapist to help them to relax and drop into their body. So these might be clients, as an example, who is sitting behind the pillow on my couch and kind of curled over as we're talking about something stressful. I can encourage them to open their body, and there's at some level they can do that with support. But then what is happening at a deeper level can't be accessed because I'm not a body therapist. What happens when we
Yeah.
combine with the body therapist is the body therapist is able to tune in to how the body is responding to the conversation, to the dialogue, to the emotion in a way that sometimes the client's not aware of, and certainly I'm going to miss because these may be micro cues. It may be changes in respiration, changes in muscular holding patterns, changes in breath, heart rate, those kinds of things. The body therapist will let me know that this client's body is responding in this way to this content, and that'll guide the conversation. It'll also provide a way for the nervous system to be deeply supported and relaxed, soothed, to feel a sense of safety. So as we're talking about difficult content or reprocessing trauma, the nervous system, instead of getting escalated, is able to receive support and staying de-escalated, so the trauma can then move through and the brain can integrate it.
Love that. So it really is a key piece. And so even you as more of like on the psychotherapy side, like really what we might call like a mind entry side, you see it in your office. And so adding that in with the SST of the body work makes so much sense for you. And so what we see in our office too is doing that same idea. And so, a lot of times when I'm looking at, okay, like how do I refer to this? Of course, I'm looking at a past history. Like, do they have a big trauma history, PTSD? Maybe more like complex PTSD, where it wasn't like some one traumatic event, but maybe a really stressful childhood, or even what we might call prolonged medical trauma. If you've
Mhm.
dealt with a chronic illness for a long time, that's its own trauma that gets encoded in the body that has to be dealt with for true healing. And so what I want for the average person to hear is like, look, guys, I refer a lot to this is, do you have tension headaches? Do you have migraines? Do you have complex symptoms that come on when stress is worse, or just that are persistent regardless of good treatment, right? Do you have chronic pain? That's a big one for me in there because we always know that pain, no matter what, I don't care what the cause is, it's always encoded in the nervous system. And SST is something that's so good at working on the nervous system level, right? So this is a good segue. So give me what a typical SST session might look like for a client. Whoever wants to jump in.
Well,
Richard?
I would just kind of add to the last thing that part of, I think, the novel breakthrough here is the simultaneous application. And somatic workers have realized that the body keeps score and that there's something going on with the nervous system and that there's patterns, but they don't know what to make
Dr.
of it. They're
Sylvester,
not.
real quick for the average person, tell me what you mean by somatic.
So any part of the body that tells a story, either outwardly or that a practitioner can access inwardly. So that may be someone who goes to a chiropractor and they have an adjustment or manipulation, and then they just have this emotional release that's kind of it seems like it's out of a vacuum. It's not out of
Yeah.
a vacuum. It's being uncorked from the body's nervous system from past traumatic patterns. So the genius, I think, was recognition that trauma often reprograms and accompanies and has a somatic, meaning body-based, specifically in the nervous system correlation that helps lock and hold the not just the injury itself, but as a barrier to recovery from that exposure to the trauma. So typically we would start a session by doing a trauma history, right? Getting
Mhm.
to know when issues started, how they presented. Is this a single incident type of trauma? How did they process and interpret it at the time? What treatment have they had? What responses have worked? What avoidance patterns? What are resourcing? These are all tools we use as a practitioner to set the stage to prepare someone to actually go in the room with two or more practitioners. So then, after we gather that initial information, we usually have them established with the body worker, someone licensed to touch, and whether that's acupuncture, like I said, massage, whatever, they would establish with that practitioner as well, because this is deeply vulnerable personal information, and you don't want to be with a stranger or someone that you don't feel safe, supported, and comfort, because that's absolutely crucial for the treatment itself. And then
So
in
kind of what you're saying is like you're not wanting any part of this to go like 0 to 100, right? So like whether it's the psychotherapy side or the body worker side, you're wanting the client who's going through it to have a good relationship, to feel totally safe in this environment.
Yeah, 100%. It's really a requirement. So and I mean to illustrate your point, someone can't pick up the phone and say, "Hey, I heard about SST or I saw an ad or whatever. I'd like to come in for a treatment." So they have to be established with a therapist, whether that's an outside therapist that we can work with. And then pre-SST, the actual navigation, the table work session, we're going to be doing data gathering in the office, and then they're all kind of simultaneously establishing, or if they are familiar with a modality, we might target that more towards the beginning to make sure they are absolutely comfortable, safe, and supported in that environment, so that when we actually get into the room, we're ready to hit the ground running and do the work.
Having been a part of some of the sessions, I can really say that the level of comfort, safety, relaxation, rapport that's built between the practitioners and between the practitioners and the client is major, right? It's so huge. And I think that's so important. And even in research, we know that rapport, right? That relationship between practitioner and client is one of the keys to success. And so I love the way you guys build that with the client. And Megan, I would ask you, from your perspective, what would you say a session is like? Like, give us a brief walkthrough of what's a session really like.
Yeah. So after we've done that preparation work in a traditional psychotherapy kind of setting, we step into a room that looks like, a lot of times it looks like a massage therapy room. So the client walks in, it's low lighting, there might be relaxation music on to set the tone. The client comes in, we connect, or check in on how they're doing and kind of where they may want to go with this session. And then they lay down on the table fully clothed. So it's not a traditional massage in that regard. They're fully clothed. And the body therapist begins to tune into their body. The session may begin with something sort of meditative. So we may play a singing bowl, or we may do a guided relaxation, some breath work, something like that, to kind of wash the day off and drop into their body and begin
Mhm.
to activate the parasympathetic nervous system and kind of begin to take an inventory and see, quote unquote, what's there. What's in the body? What emotionally is coming up? What's coming up in your thoughts? What hurts in your leg or in your stomach? Where are you holding? Those kinds of things. The body therapist is also going to tune in energetically and say and notice what they're tuning into as well. And then we all kind of,
Almost like whatever physical tension patterns are present.
you got it, right? So if they're laying on the table like this, the body therapist might notice that. And I mean, that's an obvious one, but there's subtle cues in that way too. And then we begin to process, and we process, either we're targeting a traumatic memory, or we're exploring what's going on in day-to-day life with this client, or none of the above, and we're listening to what the body is saying. And what that means is we're noticing subtle shifts in the body, and beginning to support maybe the movement of that area of the body, or the relaxation of that area of the body. And it's pretty interesting how very often emotion begins to bubble with that.
Yeah, that's major. That's a big piece here. And so seeing that, and so we're creating the environment, right? Like you guys are setting it up so the environment is right for the
Right.
person to deal with that, but feel comfortable. And then in tuning, whichever way we need to go, is there a specific event that the patient or client might know that you need to deal with, or what's the body saying? Either way, you guys can tune in and sort that out, and then process in a way that's comfortable, right? That's, well, sometimes it's uncomfortable processing, but is very held, because the way I've watched you guys do this work is between the psychotherapy side, meaning like the guided, talking them through it, helping hold their emotions, giving space, but also the physical side of the massage therapist or acupuncturist. Those folks are so held in that environment that they can process in a way, from my experience, is unparalleled, right? They can process those things in a way that's so deep, but also not as maybe scary as some of the other traditional psychotherapy methods, that allows them to get a true body, mind, and spirit healing that I'm excited about when I send patients to y'all. And so I love that. You guys are doing a really killer job on that. And the question I would ask you then is, okay, so we do a session, right? We drop in, we're in the environment, it's relaxing, we do the processing, we do the body work, we do the guided work with the psychotherapist. What's a follow-up look like? Like, how do you integrate that afterwards?
So after the session comes in for closing, as we say, right, we make sure that the client is leaving in a very regulated place. So this is doing deep work. And a lot of times, because we're integrating mind and body simultaneously, people are able to get to deeper levels faster. So a very important part of the session in general, overarching, and then in the session is safety. And part of that safety is containing, making sure the nervous system is regulated. Emotionally, they're feeling like their emotions are contained and that they're feeling safe and grounded before they leave the room. After they leave the room, then we have some self-care kinds of recommendations, whether it be journaling or being in a low stimulating environment for the next evening or day or so, and grounding kinds of things to help to continue to integrate that work. It's a really special time of neuroplasticity for another day or two, or sometimes a week or more, where the client is integrating all those shifts and changes emotionally and in their nervous system. Then we make sure that there's a follow-up session within about a week with the psychotherapist, or traditional psychotherapy session again, where they're not in the SST room with the body worker, but they come into our office and they're processing through what they've experienced. How has that created shift? What kind of insights has happened? Maybe what memories have revealed, maybe what kinds of awarenesses have happened, dreams, these kinds of things, so that they don't feel alone in having to integrate and explore all that information.
That's so key, I think, on a huge end of that aspect is like, how can we mentally integrate and emotionally integrate what we just experienced, right? And I think the big key, as I've seen, is that with that aspect is you guys are so willing to work with other practitioners. So it's the psychotherapy part gets integrated, but also the body work, whether that means moving forward, let's also continue some acupuncture, chiropractic, or massage work. But then also, like from Dr. Sylvester, which I'll have him talk about here in a second, is the functional medicine side, right? Because the idea here is not that like it's all just in your mind. That is the whole point. What I love so much about SST is that it is really the culmination of, right, that mind, body, spirit. What's going on in the thoughts and emotions? What's going on in the spiritual side? What's going on in the physiology? And so we can handle that. So on a follow up from like a functional medicine side, Dr. Sylvester, what would you say occurs sometimes?
During the session, what do we see that's differently?
Well, more so like after, like follow up
Oh
when
yeah,
someone has
yeah.
done, one or two or maybe two or three SST sessions. What are you doing on the functional medicine side to help integrate them and help them kind of move forward? And maybe even two, what do you see that changes physiologically that's easier or is cleared out afterwards?
Yeah, so it's to your point before that the connection between mind and body, once it's seen, it can't be unseen. And that's a pattern that I
Mhm.
think a lot of somatic workers have noticed, a lot of the trauma-informed psychotherapists have noticed, but never before has anyone combined that. And more importantly, combining that in real time, not just for speed, safety, and accuracy of the gold them there in the hills, whatever is the trauma locked pattern that's stuck, got somebody stuck. But once you pull on that gentle thread and nature takes its natural course to recover and process and integrate and eventually heal to a point where the nervous system isn't reactivated on triggers and they have some control over their life, an interesting thing does start to happen. Somatically, the body starts detoxing mysteriously. There's a lot of
Yeah.
people where we just really can't make headway to, and this was what you were saying before, which is really fascinating because it shows the power of the mind body connection, not just to the nervous system, but to consciousness, to the immune system, especially. And so, one thing that will frequently kick up after we've accessed and got the body sort of detoxing, not just energetically, is the immune system, its detox pathways. They will shift. So we pay really close attention in the following days and weeks, really, to see what their body's saying, how it's talking, not just like it did in the session itself, whether that's resurfacing of primitive reflexes, micro movements, things that we do during the session, but afterwards, looking for any activation signs of the body's, its detox pathways, immune system activation, nervous system stuckness, and that way we can support and maybe target what symptoms are coming up physiologically as well as psychologically.
Oh, 100%. I mean, there's a whole field of study on it right now. We call it, we don't call it, it's called in the medical literature, psychoneuroimmunology, right? How the psychological, neurological side is integrated with the immune system. And so when you release that trauma, you release those trapped emotions, whatever it is, that encoded system, the immune system can start to regulate. So if that means it now can kill Lyme, it can start going after Lyme or it can start going after gut infections or whatever it is, right, start regulating. And I've seen a lot of times, what's trapped in the nervous system or certain areas where there's trapped emotions, which there's great research on, right? Trapped emotions in body parts. There's great research on that. But what was trapped in there? So suddenly we deal with the trauma and now somebody's dumping mercury or they start dumping yeast or whatever it is. We see it all the time in our functional lab testing of, okay, you dealt with this, you went and did an SST session, you come back, wow, now you're ready to clear out this physiological aspect. And so they're so interconnected that you can't deny it. And the key piece to me, being someone who's got like more of an analytical background, is there's research to back that up of how interconnected those things are. And so it's so key to deal with it. So for us, referring patients for SST, sharing patients with y'all is so important on that aspect that you can't get away from it with complex chronic illness. That's so important. So let me recap a little bit. SST, right? Synergistic synchronized therapy, right? So you're dealing with body work, you're dealing with a psychotherapy aspect. You're really integrating all the parts that we see on there in a session. But what I think is so powerful is you're making people feel held. You're making them feel safe in the sessions. You're using whatever modalities they need to deal with those traumas, those trapped emotions, those things really holding them back. And so what I would ask though too is, and you're doing it from all angles for follow-up care, right? If they need psychotherapy, do they need more body work, do they need more functional medicine care, whatever that is. But how would they go about getting involved in this? So somebody's like, yes, this makes sense to me, or my doctor's been talking about trapped emotions, but I don't know what to do, right? How would they learn more about this? How would they get a hold of you guys? How would they do an SST session?
So we're practicing in Sarasota, Florida, and we're available for SST sessions. If people call our practices, they're able to get in touch with us to schedule an intake. And we also have a website, www.ssthealing.com, where you can learn more about the ins and outs of SST, either as a practitioner, from a practitioner standpoint, or from a client standpoint. And the first step is to call and schedule an appointment for an intake. And that'll meet with one of us and we'll get scheduled to make sure that you're a fit and that you're ready to do the work and begin that preparation process.
Awesome. SSThealing.com. Guys, if from my experience in practice is if you're dealing with anything that's been around for more than a few months, honestly, you need to explore this side of healing. So check out SSThealing.com. Dr. Sylvester, Megan, do you guys want to throw anything out there at the last minute here?
There's also a practitioner search on that website, so finding a certified practitioner in your area is an option as well if you're outside of Florida. And that list is growing constantly, so it's exciting new field and a novel approach, and we're just excited to be able to tell people about it because it's revolutionized the way we practice, and we can't go back.
Dr. Fester, Megan, thank you for jumping on and talking to me about this. It's something you guys know I'm very passionate about, the mind-body side of dealing with chronic illness and complex chronic illness and healing. It's been so integral for me personally, but also with my patients. So guys, thank you for chatting with me about it. I look forward to talking to you soon.
Thank you.
Thanks so much.